It was amazing. I hadn't read anything, and the particular teacher didn't tell me a great deal, but what she did was to get me in and out of the chair, and that was quite extraordinary. I was moving in a way that felt very strange to me, but with great ease.
Did you notice that tendency to want to just...
Certainly, months later, I noticed the shoulders were further back, and I noticed that, I wasn't sort of stooping quite so much.
When Emily came for lessons, what we were working with was helping her to find a way of releasing some of that pain. So she got out of the cycle of pain creating more tension and the tension creating more pain. This is a vicious cycle that is very easy to get into. If you are in pain, you do tense up, and that tensing in itself tends to create a situation where more pain comes in.
With the Alexander technique, it's much more gentle, it's much more changing the way you think, and that then affects the way you use your body. I was distorting myself almost. I mean, you see people walking around with very strange, people pulled down back posture, and you think, well, how did somebody get to that? And this technique actually shows us how we do get to that point, and that actually you don't have to get to that point.
In the cost effectiveness, we weighed up the costs of the different interventions with the benefits. And cost included, of course, the cost of delivering the intervention, but also any costs of health service use, so visits to the GP, outpatient appointments, and so on. And all those were compared with a range of benefits.
At the end of a year, people who'd had no intervention had about 21 days of reported pain in the last month. And if you had 6 lessons of Alexander technique, you'd improve that by about 10 days. And if you had 24 lessons of Alexander technique, you'd improve that by about 18 days. So you've gone down from 21 days to about 3 days of reported pain. So really quite a marked improvement. In healthcare, what we need to know is not only whether something's effective, but whether it's cost effective. And the standard measure that we use is the cost per quality adjusted life year.
The threshold that NICE uses is somewhere between £20,000 and £30,000 per quality adjusted life year. And this combination of 6 lessons in Alexander technique and an exercise prescription came in well below that threshold.
Alexander technique 24 lessons comes in at under £20,000 per quality adjusted life year, and both exercise prescription and 6 Alexander lessons come in at under £10,000 per quality adjusted life year. So it's very probable that these interventions, if you like, are cost effective for the health service. But what you want really to do for patients is both have something that's both effective and cost effective, and probably the best bet there is 6 Alexander lessons combined with exercise prescription. Although it's just one trial, this is a big trial with lots of teachers in lots of practices, so I think it's very unlikely that actually these results wouldn't be replicated. So I think actually this is an example of one large trial where the NHS might consider using it. And certainly it's something that GPs can advise to their patients as something that is likely to be helpful.
In the Alexander community, we're absolutely delighted that this trial has been done, because obviously for those of us who practice it and work with other people, we've seen the benefits for years and years and years, and yet it's been one of those things that's been quite hard to kind of get across, particularly to the medical profession, that it is something that can help a lot of people and doesn't involve drugs. So it's been really exciting to see the trial in progress and then to see the results that came out.
The slight catch is that it's not a technique that's a magic bullet. It's something that you have to learn. And so you have to be prepared to put in time to learn it. It's one thing to show that something works in a private setting where people are likely to be highly motivated, they're paying for it. And it's another thing to show that it might work in a setting where it's been provided for you. So I think that's one of the great values of this trial.
The fact that the BMJ have published this paper is wonderful. We were always told we were incredibly lucky to get the money from the Medical Research Council to do the piece of work, that it was a real first to get blue chip money to do a piece of research in complementary and alternative medicine. We're thrilled that the BMJ had enough confidence to publish it. There's been quite a lot of interest in their rapid responses, suggesting that perhaps they shouldn't have published it for a variety of reasons, but they have. They recognise it's good science, and that this is an intervention for back pain which we think a lot of people could benefit from.
If I hadn't been recommended it by somebody, a respected person in the medical profession, I would never have come to it.
It really does work, and it's not about taking tablets or having an operation or continuously paying somebody to make you better. You can make yourself better.
I think thousands of GPs are very keen to find something that's going to help their patients with back pain. If you think about the fact that you've just got one back, only one, nobody's going to give you another one, unfortunately. And for the cost of, say, a holiday, you can invest in learning to look after your back, learning to look after yourself in a way that's going to last you the rest of your life. I think that's got to be good value for money.